whole mouth is swollen up.
What's happened? Is she eating something? She's coming in. Thank you. The first thing I noticed when I saw her, she had quite blue lips and a distinct rash on all over her back.
14-year-old Chelsea and her parents are visiting from South Africa.
So what's happened?
Look at her lips, it never looks like that.
Okay. Has she got any allergies at all?
Not that we know of.
We needed to work out what had happened to her. We needed to use a process of elimination.
No, she got stung at all.
Yeah.
I'm not sure. I wasn't with her in the water, so it could be a blue bottle. I'm not sure.
Beardy and Jackson need answers fast.
She's having a reaction, her lips is all swollen up.
Yeah. Have you been in the water?
Yeah. We asked whether she was in the water or anything she'd been in contact with.
Ambulance, Bondi Beach. It's the Lifeguard tower. Can you feel any restriction breathing in your throat?
We weren't getting the answers we needed, so we're just trying to work out what it is.
Then, crucial information from Chelsea's dad.
About 2.5 hours ago, she had some shrimp for the first time with her.
Oh, okay, yeah.
Dad tells us she's had prawns, so straight away for me, anaphylaxis.
Yeah, I think probably maybe a bit of anaphylaxis to it.
Can you help?
Yeah, we can have an EpiPen. We've got an EpiPen there.
With the EpiPen, you put that straight into a patient's leg and that administers life-saving adrenaline.
We're going to call the paramedics to come down.
We do all the training down at the beach with the EpiPen, but I'd actually never administered the pen before. It's not an easy technique. Both the ends actually look quite similar.
There's a button on one end, and if you put it in the wrong way, you get the needle straight in the thumb, and it is a thick gauge needle.
I was about to give her the pen and I was reading the instructions on the proper technique.
Anaphylaxis to seafood. We're administering an EpiPen.
I'm feeling a bit nervous at this point. I honestly think I'd be better off paddling out in 8-foot surf trying to pick up a patient. But I'm gonna have to do it.
All right. Just lean. It's okay.
One, two, that's all right.
It's okay.
It's okay.
Yeah.
It's okay.
There you go.
That's okay. That'll make you feel better.
That's all right. That's all right.
How are you feeling better?
A little bit.
A little bit. As soon as I administered the pen into Chelsea's leg, within moments, she was feeling 1,000 times better.
Look, it's the first for everything.
It was the first time I've given an EpiPen too. So I tried to act like I knew what I was doing, but I think we got it in there.
Just stuck in.
Yeah.
You look like you're feeling much better. Yeah.
As soon as they looked out at him laying there on the ground, I knew right away someone had been hurt. Let's go.
It's Super Bowl day. A group of gridiron fans are celebrating with a game of their own. But a rough tackle brings it to a shuddering halt.
Jack and I headed down to assess the patient. We just saw he was in a lot of pain.
He's not a fan of gridiron, but joined his mates to watch the Super Bowl at a local pub.
So you guys have been drinking all day?
Since like 11:30.
Yeah, all right.
No one seems to be taking responsibility for the tackle.
We're playing football, a friend got tackled accidentally, and now he's hurt. That's pretty much all I got to say.
Yeah, I don't think the guy in the white bandana probably wanted to say much at all. I heard he was the one that put the hit on. I reckon we get him up into the tower. We try and get him on some oxygen. He's definitely in a bit of pain. Yeah. You can tell he was in shock. When people go into shock, their skin goes clammy and pasty, and he was sweating a lot. All right, Johnny, we're going to try and get you in here somehow.
Could be a bit of pain here, okay? Good. The other side. From the other side, be easier.
Yep. Ready?
On the count of 3, 1, 2, 3. You're right, mate. You're right. You're right. Big breaths, big breaths.
All right, so we're going to spin around. So yeah, John was a big boy. We had to get him up the beach. It took a few of us, and as we were sort of walking towards the pavilion stairs, he had a bit of a cheer squad, and they were all clapping him off the beach.
That's a good team effort. Clap him off the field. Solid effort.
Sorry, mate.
Increasing oxygen supply will help John cope with the trauma.
How's that pain out of 10 now?
So when we're looking for injuries on people that aren't obviously compound fractures and where we can't see what's going on, we've just got to feel around. Where's the pain? Am I getting closer to it?
No.
No? Further up?
Pretty low,
Lower?
Yeah.
So it's in your ankle?
Right.
Right, down there. Sometimes you'll feel really where the pain is and the patient will let you know.
So I'm just going to run.
We're going to avoid giving you the whistle just because you've had a few drinks. Seem to be managing the pain pretty good. We knew he'd been drinking since about 11 o'clock. It was now 4 o'clock. He wasn't overly drunk, but in those sort of situations, we try and avoid the green whistle when we can. Did your team win today at least? What's that?
Had a good tackle. Yeah, going for Dwayne.
Oh, you tackled him?
No, it was other player.
Gotcha. So the ambos arrived and they did their own assessment of the patient, but we had to get him out of the lifeguard tower. We're gonna try and get out through here.
Some of John's pain may be dulled by the earlier trip to the pub.
Someone get ready to support his leg.
But it comes with side effects.
So the first few spews, they just head out onto the promenade, something for the local dogs to have for lunch. The poor guy needed to vomit.
Doctors discovered that John tore ligaments and fractured a leg bone. Following an operation, he faces 2 months on crutches.
Hard to move my arms. Okay, really hard to move my arms. Has this happened before? Happened last week. I'm so sorry. What do you want me to do? Can you massage my arms? Can I massage your arms? Like that?
He was complaining of pain in his hands, and I looked down and he was gripping them really hard. His fingers were white and almost looked like he was breaking his own thumbs. He was gripping it that tight.
Hey, just... I'm going to do that one. Yeah, you want to try? I want to try and get this finger back.
Try and release this for me, buddy. His grip was insane. I don't know if he's normally that strong, whether he was full of adrenaline. It felt like he was breaking my fingers with that grip, and I was trying to help him out.
You right, Kane?
My hands.
Let's give him some oxygen.
His pulse was just all over the shop. At one stage, it was as low as 44, and then it was rocketing up to 110. And that's when the hands would start to just go into the death grip.
We haven't got any shade, do we?
No.
All right. Come on, mate.
Let's get you up on the grass.
He's not in a very good way.
If the pulse is going from 44 to 110, alarm bells are ringing straight away. Your heart shouldn't be jumping in between those two numbers so quickly, so something's going on.
Yeah, lying him down after hot things is probably the best thing to do.
And do you have any medical conditions? Yes? No?
Clenched hands could be a symptom of a panic attack. Lifeguards are concerned it could also indicate a heart condition.
The clenched hands is a bad one. How you feeling, Kane? Okay. Yeah, we got your hands, mate.
They're getting better.
Yeah, he's not well.
Well, no, it's cramping up again. Cramping up, yeah, he keeps cramping. He keeps going in and out of it.
Yeah, it's definitely. Don't be surprised if it's cardiac. His breathing's getting. Hey, Kane.
And then he sort of just stopped talking. When he was just lying there, his pulse, it was rocketing up to 110, and he's almost like he's, done a couple of 100-metre sprints back to back. Kane, alarm bells are going off, so all we really want is that ambulance to get there and get there fast.
Nothing.
Yeah, something's not right.
Kane, that defib's ready to go, eh?
Yeah, it's just on here. Yeah, I'll just rip the pads out if we need to.
Oxygen treatment helps revive the man.
That's it, buddy. You're okay.
We've got the ambulance down here to come and check you out. We're not letting you leave here until we see the ambulance, okay, mate?
I checked last week.
Yeah, I know. You checked with the doctor?
I think I had mental problem.
He mentioned some mental health issues, which leans me towards maybe a panic attack or an anxiety attack.
Maybe heart.
Maybe heart. Maybe heart.
Not sure.
Yeah, okay. Have you got any pains in your chest?
No.
Nope. Here they come now.
Relax your hands. Relax.
The doctors are here now, mate.
It's okay. I don't need to go to hospital.
You might not have to go to hospital. Need some getting attention. Hello. How are you?
I'm good. How are you?
This is Kane.
Hey, Kane. My name's Anna, and I've got my partner Dan here with me. Are you on any medications?
I can tell you.
Yeah, tell me, go on.
I went to hospital last week.
Do you remember what it was for?
Because mental problem.
Yeah.
And I got a pill.
You know, we're just worried about him having a heart attack, basically. That's what we're kind of set up for. For a minute there, it kind of was going that way, I think, but he looks better already.
It happened last week?
The same thing happened last week.
Yeah.
And is that why you went to the hospital?
Yeah.
Yeah.
And it's worse than last week.
Okay. Might be a good idea to come up to hospital just for a checkup. I'm a little bit concerned.
No. I can go home by myself.
Yeah.
And we'll be fine. And thank you for everything, everyone.
With so much uncertainty around the condition, lifeguards and first responders are anxious the man gets a more thorough examination.
What about if we just check out your heart in the ambulance?
Come on, mate.
Everybody's here to help you.
Yeah, just one more checkup and then that's it, okay?
Yeah,
we can take you home if you like.
Home, mate.
Yeah, you'll be much safer then. Yeah, and then that way, everybody here knows that you're going to be safe.
Come on, mate.
Let's do that, hey?
Yeah, I think so.
Yeah,
Come on, we'll just walk to the ambo.
We like to learn from each of our patients, whether we could have done something better. So when it's unresolved, we don't really get that learning experience, but, you know, he left conscious and alive, so we're always happy with that result.
He's had surgery for a gunshot wound and he's in 10 out of 10 pain.
One got pulled up in front of us and I slammed the brakes and told the other bloke, get out and shoot the hit the 22 Magnum sits up. As he got out, he turned towards me and shot me straight through the stomach.
The lifeguard's main concern is the possibility that Phil is bleeding internally after his last operation. Lifeguard medical training isn't sufficient for this situation. A dose of the green whistle has failed to dull the pain. The second green whistle starts to take effect.
Beardy had been putting all this time and effort into this bloke to get him healthy, and it turns out he's only trying to get healthy so the guy could go and date Beardy's missus.
Your missus picked me up from there.
My missus, I hope not, she's pretty short.
Obviously, this bloke, he was 2 whistles deep. He was letting his imagination get the best of him.
A little bit, I reckon. Oh, no. You're right. Just relax for a second.
Straighten your arm for me, mate.
When the paramedics eventually arrived, you know, it only took a quick assessment of the guy and they realised that he needed further medical help. We'd looked after this bloke as much as we could and he just needed to get to hospital and be seen by a surgeon.
Extra dry for you, normal for me. Ryan.
Cheers. Thanks, boys. Got your phone, Phil? Your pocket all good.
Mate, if this bloke legitimately had a crack at Beardy's missus, I think Beardy'd be single pretty quick.
Phil was taken to hospital, where wounds from surgery will be reassessed.
From far away, he looked dead. You hear that someone's fallen from a height. First thing you think is they've hit their head. You take those things pretty seriously. Hey.
First-year lifeguard Will hasn't dealt with a medical emergency like this.
Buddy still wasn't responding, so I thought that there was something immediately wrong.
Hey, Central, the bloke is not very responsive. He's breathing. He smells like he's drunk a fair bit, but I think he might have done a bit of damage to himself.
Will can't be sure if the fall caused the teenager to become unconscious or something else. Head lifeguard Hoppo, Gonzo and off-duty lifeguard Harrison assist.
First thing we did is we got in there and just did the sternum rub.
What's your name?
When we found out he was conscious, went through all the checks for spinal.
Lifeguards are concerned he may also be drug and alcohol affected.
Mate, can you tell us what you've taken? Any alcohol or drugs? Yeah. What have you taken, mate? Just we've got to try and help you out. What have you taken?
As soon as we heard drugs were involved, we were thinking it might have been an overdose. How much have you had?
I was quite concerned. He reeked of alcohol. He'd supposedly taken, and I don't know how much he'd taken.
How many?
The person at the other end of his phone may have answers.
Mate, I need to ask you a few questions. How much has he had? He's told us he's taken.
No, he's just drinking.
Mate,
He's not getting in trouble.
He's not going to get into trouble, but we just need to know because your mate's, he's not in a good way.
No, I wouldn't lie to you. He hasn't taken, from what I know, he hasn't taken any from a shot.
All right. And then his mate started rocking up. And the situation just escalated. They saw the cameras, they saw the crowds. Hey, is this your mate?
I'm best mates with him, bro.
Yeah, all right.
That's all right.
Just stay there, please. Stay there.
Relax, mate. Oh, we just need to know how much is the owed.
Watch out, wait. Step away from
At least
me.
it's not even a whole one. Not a whole one.
It looks more than alcohol. You'll be able to get through to it. It's more than alcohol, mate.
Just waiting for him to walk up to the church.
They kept trying to get really close to him.
Can I please have the word to him?
Mate, he's not responding to us. He's not going to respond to you. They were young, full of grog, and I think, yeah, the emotions just got the better of him.
Lifeguard's immediate concern is that he could choke on his own vomit.
Yeah, I reckon we get him out now. He's had half a bottle of vodka, he's taken an MDMA, and he's in between a parking meter and a wall. So we knew we had to move him out of that position just in case he did vomit.
Just keep him in the shade.
We needed to make sure that he was on his side and had the best chance to not, put that back down into his lungs.
The ammo's just coming down right now.
Half a bottle of vodka. Yep. And he's told us he's had MDMA.
Okay. Did he have MDMA?
Gentleman came over to us, saw him jump off the wall.
Jumped? Feet first?
I would assume there's no injury to his head or anything. So.
As a precaution, paramedics use a spinal collar and board.
The whole time I was really hoping that the kid would end up getting them fluids up out of him.
Let's get him out of here, mate.
But if he vomits on his back, it's going to go down into his lungs.
Then, at the most precarious moment, the worst thing happens.
Have you got the airway there?
The teenager's airway is now the priority. The spinal collar must be removed.
Have you got the airway there? All right. Flip side.
As disgusting as it is when someone vomits, in this situation, it was really good. You knew this kid was getting some of that liquid out of him.
His airway is now safe. At hospital, the teenager will be treated for an overdose and assessed for other injuries.